Hello friends, myself Asha Talwar from Radiance Diagnostics. Back pain is one of the top reasons people visit doctors worldwide. And whether you are 22 or 62, your spine is silently working overtime. But are we listening to what our back is trying to tell us? Welcome to the Ortho Series on ViewBox by Radiance Diagnostics. Today, we have with us Goa's renowned spine surgeon, Dr. Sunny Kamat. Thank you, Dr. Sunny, for joining us today.
Thank you so much, Asha, for inviting me today on this topic. And I also thank Radiance Diagnostics for arranging this topic so that I can express my views on it.
So, Doctor, let's start with a big question. Back pain in your 30s is common, but should it be?
The thing is, it all depends upon our lifestyle. Okay. So if you see that in recent time, because of the evolution of the IT industry and because of laptops and computers, most of our jobs are in a sitting posture, the desk job. So we are basically not designed to sit for long hours as human beings. Because for centuries or millennia, thousands of years, we've been walking. Initially we were hunter-gatherers and we've been walking a lot. But suddenly that shift has happened from walking to sedentary lifestyle. And it starts with in a much younger age, for example, for in school, then follows by the college, and afterwards the job. So most of our population is in the urban population, I mean to say, is involved in a desk job. So what happens is that when you in a sitting position, the biomechanical pressure on the spine is always higher as compared to when you are standing. So because of this, most of the young people, they are having more of a back pain as compared to 30-40 years back.
Okay. Doctor, you said IT people, they sit like for long hours. Like what you suggest, like in how many hours they should take a short break?
So ideally speaking, they should take breaks every half an hour, 45 minutes, move around, stretch a bit and come and sit again.
Okay.
And the posture also matters a lot.
Okay. If we talk about sleeping posture, does it affect our back pain?
Yes. Ideally, we are supposed to be sleeping on our back. That is an ideal position, with a pillow below our knee. So to relax the spine, that is an ideal position. But people who sleep on one side, they should take a pillow which is little bigger so that the neck remains in the neutral position. And ideally, the pillow should be between the legs if you're sleeping on the side. Sleeping on stomach should be avoided because that puts your spine in strain, in hyperextension. If you are used to sleeping on stomach, on your abdomen, then you should keep a small pillow below your hip so that the hip gets elevated and your spine goes into the neutral position rather than hyperextension.
Okay. Are we damaging spine health at gym? Sir, most of the people we see now, youngsters, they want to go to gym and...
Absolutely. Now, everyone knows that gym is in fashion. And I get so many patients with back pain. And the common history is deadlift. And the most commonest cause for the back pain, people who go into the gym, they are not advised properly, or they are not aware of certain things which you should follow in the gym. For example, you should lift the weight according to your capacity. You should not feel insecure that someone else is lifting so much of weight and you are not able to do it, because every individual is different. Okay. And I feel if you don't fall in these two categories, you should never do deadlift. One thing, if you're not a professional athlete. Secondly, if you are not competing for any powerlifting competition. So if you don't fall in this category, don't do deadlifts. Very simple and straightforward. because once you develop spine problem, it stays with you. And definitely there are other care what you should take in the gym. For example, before the start of your gym, you should warm up properly. You should stretch your muscle properly. And after the gym also, it is important to cool down by stretching your muscles.
So immediately we should not start.
No. Warm up is very important.
Okay. Doctor, what is exactly slip disc?
Okay. So to tell you briefly, our spine is made up of multiple bones. So if I show you on this model, so this is the spine. Okay. There are many bones in the spine which are stacked upon each other. Now, our spine is flexible. Why it is flexible? Because between these two bones, there is a structure called as a disc, which is made up of gel inside, right at the center. So that gives the flexibility to our spine, and it also acts like a shock absorber. So to anything flexible should be. It cannot be hard. So God has made that the disc into something called as, it has given a structure called as nucleus pulposus, which is a gelatinous form, and it is right at the center of the disc. So whenever the outer part of the disc breaks out, the inside part naturally comes out. It herniates out. That is called slip disc.
Oh, okay. Doctor, if I'm having back pain, should I rest for some time or immediately I should see a doctor?
See, 90% of the back pain, it resolves with time. Okay, that is a good thing about back pain. And you can initially try your home remedies. If the back pain is not associated with injury, okay, you can follow some routine home remedies. For example, icing, applying some ointment, and rest. That's important. If in spite of that the pain persists, then only you should see your doctor.
Okay. And doctor, what is this sciatica exactly?
Okay, sciatica it comes from a nerve. Basically, there is a nerve called sciatic nerve in our body. Okay, now this nerve basically it goes from the back, our lower back, to the legs. Okay. And the name of the nerve is sciatic nerve. So any compression of this nerve, which gives you the radiating pain or the pain traveling from your back to your leg, that condition is called sciatica.
Okay. And we were talking about slip disc. Like, how can we diagnose this slip disc?
Okay, there are two ways of diagnosing this slip disc. One is clinically. Okay, there are some clinical signs and symptoms from which we assume that a particular patient might be having a slip disc, and the sure shot method of diagnosing a slip disc is MRI scan, because MRI scan is the best modality of what we have in current era to diagnose the slip disc.
Okay, doctor, many people panic after seeing a bulge in the MRI reports. So does everyone with a bulge, they have to take treatment?
No, see, we should remember that when you come to the doctor will not treat the MRI. The doctor will treat you as a patient, not the MRI films. So there might be bulges in your spine which are not significant or not relevant. Okay. So all the bulges may not give you pain. Okay. So what I'm trying to tell you is that we correlate the clinical findings with the MRI findings, and we come to the conclusion.
Okay, so every slip disc does not end in surgery?
No, never.
So doctor, those who need surgery, so what change is there in spine surgery?
Yes, definitely, Asha. Then currently the medical science has advanced tremendously. For example, few years back, 20-30 years back, we used to have landline phones. Then came the mobile phones. Now we are using a smartphone.
Yeah.
So similarly, the medical science has advanced, okay, in all fields, and spine is also a field where the advances has happened. Okay. So currently the most advanced technique in spine surgery is something called as endoscopic spine surgery, okay, or a keyhole surgery, in which what we do is that with a small incision, which is less than 1 centimeter incision, we can operate the same condition which required 10 centimeter or 15 centimeter of cut. From 15 centimeter cut, we have come to 1 centimeter cut. Okay, so which is the most advanced technique which I do. I operate regularly endoscopic spine surgery, and most of my patients are extremely happy post-operatively because of small incision, there is no pain after the surgery. It is absolutely safe. There are no complications. There is no bleeding. Chances of infections are very less, and the recovery is very fast.
So how many days the patient should rest, sir, after surgery?
After surgery, I discharge the patient within 24 hours after surgery. Suppose if I operate you today, I usually discharge the patient next day morning.
Okay.
And the patient is able to go to work within 15 days.
Doctor, if there is one thing you want to tell every person should do to keep their spine healthy every day, what it will be?
Actually there are many ways. There is no one particular way of following to keep your spine healthy. But I'll tell you I'll mention some couple of ways how we can keep your spine healthy. One is you should have a proper lifestyle in which you should control your weight. Okay. Secondly, you should have a proper posture, regular exercises. The bare minimum exercises what you can do is simple walking. You don't have to do gymnastic. Just simple walking is more than enough. Walking for half an hour, 45 minutes in a day is sufficient to keep your spine healthy. And eating regular food, so eating a good and a balanced diet, and taking less stress.
All right, doctor. Now it's time to burst some myths. So I will tell you the myths. You can just tell me it is true or false and one line on that. Why it is so. So complete bed rest is best when in pain.
Yes, of course. When you're in terrible pain, I usually advise the patient for bed rest. Okay. And that bed rest is usually for 1 or 2 days, not more than that. Once you're comfortable moving out of the bed, there is no need for any bed rest.
That's satisfying sound of cracking your back harmful?
It's not usually harmful.
So is it helpful?
So it is something which is very controversial. What I assume from the question, I think you're trying to ask me whether chiropractic is good or bad. That's what I interpret from your question. See, if you're already having a spine problem and it is diagnosed on MRI scan, for example, a significant slip disc, manipulating or cracking your spine is going to worsen your problem. Okay. So if you're not having a major spine problem, for example, sciatica or a severe back pain, then doing chiropractic therapy will help you. But if you are in terrible pain, I would advise never ever manipulate your spine.
Just now you told us about stress. Don't take stress. Stress causes slip disc.
No, stress doesn't cause slip disc, but stress can amplify your pain.
Okay.
It increases the tension in the muscle. It keeps your muscle stiff all the time. And usually if the pain is moderate, but a person who's in stress will feel the pain, the intensity of the pain will be much higher, what he perceives.
Okay.
So the perception of the pain is higher when you're in stress.
Next one is wearing a back support belt with weakened back muscles and make you dependent on it.
Yes, back support should be only worn when you are in acute pain. And I don't advise back support for more than 1 or 2 weeks. So once you are pain-free, it is better to strengthen your back muscle and regain the strength in your muscle. and you should never put a habit of wearing back support for a longer duration, because eventually that will weaken your muscle and it will further deteriorate your spine.
Surgery have low success rate and is risky.
No. A good indicated surgery has a very high success rate. Okay, and surgery is not risky anymore in current era because of the excellent anesthesia. All the surgeons are trained very well. They know what they are doing, and complication rates in current era is very less. So I would advise you, you should always go and see a person or a doctor who is specialized in spine, because spine is a complete different specialty. For example, me, I'm specialized only in spine, and orthopedics is a general part of it. But I see more of a spine cases. So I'm trained in spine. I've been trained in Germany. I've been trained in all major parts of India, and so you should consult a doctor who is a specialist in spine.
So a slip disc means you can never play sports again.
No, it's not true. Most of my patients whom I operated, they are playing badminton, they are playing football, they are active in life. Okay.
So once they recover, they can
resume their sports.
Okay. Obese people are more prone to spine issues.
Yes, because of obesity, the strain on the lower back is always higher. Because of the obesity, the bone quality is weak, and because of obesity, the muscles are usually weak. Okay, so all this contribute to your spine problems.
Okay, so doctor, if a person is gained weight and he's suffering with some problems like this, and again if he comes back to his normal BMI, so he'll be fine.
He'll be fine.
Okay. Sleeping mattress can impact spine health.
See, this is all subjective. It is not specific. All individual is different. Some people find better on a foam, memory foam. Some like it on coir mattress. Some like it on spring mattress. So there is no specific mattresses as such. But ideally, what I advise is sleeping on a firm mattress, whichever you're comfortable. That's more advisable, but ultimately depends upon person to person. Whichever mattress the person feel comfortable, should go for it.
Back massage can fix back pain.
It will give you temporary pain relief. You might feel a little better, but it won't fix your back pain. Back pain gets fixed naturally, because 90% of the time our back pain gets fixed on its own, because our body has good healing ability. So it's not right.
Okay. Lifting heavy items cause slip disc.
Yes, it can cause slip disc.
Dr. Sunny Kamat, thank you very much. This was truly eye-opening. To our listeners, don't ignore back pain and don't fear it either. Listen to your body. If this episode helped you, follow us, share it with someone who sits all day, and drop your questions in the comments. Till then, stand tall, sit straight, and move often.